Hi, I'm Dr. Barbie Allegretti. I am the functional medicine doctor here at Supreme Wellness, and I'm going to talk today about gut health. So, a lot of times people don't want to talk too much about what's going on in the bathroom with bowel movements, but it is very important, and it's a conversation that I have with patients on every initial visit and subsequent visits too. It's something that you do want to have in check, and if it's not in check, then work up why it might not be. And that's because the gut is the final destination of things clearing out of your system. So, but then it's not only just that, it's also where nutrients enter the system, where, you know, immune function happens, where modulation of neurotransmitters, things like serotonin happen. So it can affect a lot of different things, like mood, weight, hormones, metabolism. It can really trickle into every other space in the body as far as the influence. So one thing that I go through on the initial intake with patients is just assessing their overall gut health. So doing a quick gut check, here's some simple questions that I ask patients. Any problems like gas, bloating, reflux, any history of things like blood or mucus in your stool. What's your stool form like? Is it more watery? Is it more hard and fragmented? Is it well formed? What's the color look like? Is it normal brown color? Is it light clay color or green? All of those things give us a different idea of what could be happening in the body if there's a problem. And then those are like the normal questions. Well, also things like how often do you have a bowel movement? Once a day or twice a day is ideal. If it's beyond that, you might want to look at why. Again, because that is the exit, of all of our metabolized byproducts of things happening in our body. So that's kind of assessing what's the gut check. Next up, we might want to do some testing. So you can test some things through blood when it comes to the gut, but a lot of times I do that through stool to actually look at the environment of the gut. And this is different from something like a colonoscopy that is a procedure that's going to look at what's happening in the tissue. A stool test actually takes your poop and looks at the environment in the gut. And that looks at things like enzymes, protein, fat, carbohydrate breakdown, inflammation, immune function. It looks at a lot of different bacteria to see if there's too much or too little. It looks at bacteria to see if they shouldn't even be there at all. So that would be a pathogenic bacteria or infection. And looks for blood in the stool, bacteria like H. pylori, parasites, lots of different things. So I could go on and on. But that's the stool testing. And then we want to support findings from that. But we also want to consider other things that play in with the gut as well. How are you eating? How are you sleeping? Are you stressed? But diet is going to play in significantly with gut health and function. So we combine all of those things, lab result findings, stool result findings, and what's going on for the individual, and support that to help with weight, to help with mood, to help with skin, joint pain even. Symptoms don't have to be related to the gut. Symptoms in the body can present from problems in the gut.